everyone out there, it's Roberto Miki again, and we've got question number 3 in a series of questions we have for anyone studying for the board, such as a resident or medical student. And well, let's get right into it. Plug for the channel, hit like and subscribe and help out our channel so we can continue making these videos. A postpartum 30-year-old female presents with radial-sided wrist pain which worsens with ulnar deviation of the wrist. Bracing and anti-inflammatories have failed to improve her symptoms. What is the next appropriate treatment option? A. Inject the carpal tunnel with steroid. B. Inject the radial nerve as it exits from beneath the brachioradialis tendon with steroid. C. Inject the first extensor compartment with steroid. D. Inject the intersection of the extensor pollicis brevis and the radial wrist extensors with steroid. E. Inject the first carpometacarpal joint with steroid. So if you want to think about the answer, please pause the video at this point in time because we're about to give the answer. The scenario given in this question is a classic problem which I see almost every day in the office. It's a disease called DeQuervain's tenosynovitis. The tendons of the first extensor compartment become inflamed and the radial side of the wrist is painful. There is a classic test called Finkelstein's test or Eichhoff's test, which is a provocative test which entails ulnar deviation of the wrist, which then elicits pain on the radial side of the wrist. And this is an indication of Dequervains. If bracing, activity modification, and NSAIDs fail to improve the symptoms, then steroid injections are indicated. The steroid is injected into the first extensor compartment, which is on the radial side of the wrist, and that extensor compartment contains the extensor pollicis brevis tendon and the abductor pollicis longus tendon. This transverse cross-section of the wrist contains the first extensor compartment, and here it is in red. It contains the abductor pollicis longus tendon and the extensor pollicis brevis tendon. This is a clinical photo of the radial side of the wrist, and you can clearly see the first extensor compartment there, and that's the extensor pollicis brevis tendon that's outlined there. The circle depicts where the first extensor compartment is and where you would inject the steroids. So the answer to the question is C. Inject the first extensor compartment with steroid. The major downside to injecting the first extensor compartment with steroids is that people occasionally get a bleaching in the area. Well, thanks for watching, and we'll see you at the next one.